Alrighty. So we are officially live on both platforms, or actually three platforms. So this is Dr. Latoya Wells with Wells Legacy Health and Wellness. Wanted to welcome you to another Wednesday, Wellness Wednesday with Dr. Wells. This month we have been discussing making sure you're taking care of your immune system, taking care of your body. And tonight we're going to continue that conversation. We will discuss the immune system and the different aspects of the immune system, but we're also going to discuss another topic, and I mentioned that last week, that we'll be talking about HIV. The month of December is HIV and AIDS Awareness Month. December 1st is HIV and Awareness Day. And so I wanted to, sorry, somebody's calling my phone. Nobody has this house number, but anyway, wanted to just give you a little statistics on HIV, and it's still here. You know, we don't hear much about it, but HIV and AIDS are still here, and we have to be careful. We have to be vigilant. We have to be educated. We have to get tested. We have to take care of ourselves. And so we're going to discuss those things tonight. So again, this is Dr. Latoya Wells with Wells Legacy Health and Wellness. I am the owner of Wells Legacy Health and Wellness, and I'm a family nurse practitioner who holds a doctorate degree in nursing. I'm excited to be here with you all. I'm grateful each and every week you all show up and support me, and I just want to say thank you for that. So the immune system, we talked about some of the things that you can do to take care of your immune system. Our immune system is here to help us. It helps fight off bacteria, it helps infection, it helps to kind of keep us healthy. And when our immune system is not up to par, it impacts every aspect of our lives. And so the role of the immune system is to, one, protect our body against infection and disease. The immune system is built up of several different components. You have the white blood cells, you have the different antibodies, you have the lymphatic system, which kind of moves and drains fluid throughout your body to help maintain balance. And so all these different components and cells and antibodies work together to protect you. And again, if something is off, then that's when we see infections. That's when we are susceptible or at a higher risk for developing or catching or coming down with different viruses and the flu, the COVID. We talked about that flu, COVID virus, RSV, things of that nature. So we, one, have to make sure that we're taking care of our body. We talked about last week some of the things that influence the immune system, its health, is your lifestyle, things that you're doing. So your diet, exercising, sleeping, so stress management, making sure you're getting in a healthy diet, making sure you're staying hydrated, drinking, the water. All those things are ways that we can boost our immune system and make sure that it's staying healthy. When we're lacking in one of those areas, then we're in essence putting our defense mechanism at risk. And our defense mechanism is our immune system. And so we have to make sure that we're doing our job to help our immune system work to the best of its ability for us. With the immune system, whenever there's a infection trying to start, the immune system will send the white blood cells, and it'll send the helper cells. There's different cells of the immune system. And we're not going to go into much detail about that tonight, but just know I think of, in a way that I explain it to some patients, is many of us know of Pac-Man. Well, I think there's more of us on this live that I'm seeing right now know about Pac-Man, the game that we used to play when I was younger. That was the game. I love Miss Pac-Man, what have you. And so you had Pac-Man, who was going to eat the little dots, and then you eat the ghost and it kind of supercharges you, right? Well, your immune system, anytime that there is a infection, your immune system sends these cells to that area. They go, they check out the cells. They're like, something's not right. We're going to try and get rid of these cells because they're here. We see them as something that shouldn't be here. That infection has showed up on the scene and it shouldn't be here. So your immune system sends those cells to get rid of that infection. And then when we look at your blood work, we see, if we're looking for any type of infection, we'll see that the white blood cells will go up. And that's because that's the immune system doing its job to try and get rid of that infection. Now, there's a difference, right? When we're dealing with a virus versus a bacterial infection. And so when someone has a virus such as RSV or the common cold or flu virus, the body and the immune system will respond in a similar manner. It'll send those cells, have it do what it needs to do. You'll see, individuals not feeling well. They'll feel really tired and lethargic. They'll develop a fever. And if we allow that virus to take its normal course, and typically the flu, the common cold virus has a progress, it has a time frame of which it usually will kind of run its course. You usually will treat the symptoms. But if we're looking at the immune system and the response, within 24 to 48 hours, you'll begin to see an improvement in those individuals who have a common cold or flu virus. Sometimes we have that 24-hour rhinovirus that goes around, 24 to 48-hour rhinovirus that goes around. And so what happens is the immune system sends those helper cells to that area to get rid of those bad cells, that virus, and you will begin to see your body respond in a certain way. And that's what's supposed to happen. Now, when that transitions over from a viral infection into a bacterial infection, typically has a time frame that we look at it, because usually if someone has just like a common cold or flu, that individual should be, if they're healthy and their immune system, they don't have any issues going on, they don't have a compromised immune system, they should be well within 3 to 4 days. They should start feeling better. It's when there's something else going on with the immune system, we may see a prolonged incidence of that virus. However, some viruses can turn into, a viral infection can then turn into a bacterial infection, depending upon what type of virus or illness it is. And then that's when we have to look at, are antibiotics required? And so the body will kick in and it'll do exactly what it needs to do. But we have to do our part. We got to make sure we're eating well. We got to make sure we're getting fluids, make sure we're exercising and staying healthy, make sure we're getting rest. All those things that we talked about last week help to make sure your immune system is intact, doing what it needs to do. Now, when we come to HIV, and you guys know each month I discuss a different topic. And so the month of December is HIV and AIDS Awareness Month. December 1st was HIV and AIDS Day. And so I want to read a few statistics for you. And this is based on data from 2022. The number of newly people infected with HIV, especially children, and the number of AIDS-related deaths have declined over the years. So we've seen a declination or decrease in individuals who are infected with HIV. And then the number of AIDS deaths have declined. And that's due in part to research. That's due in part to different medication and treatment options that are available. So we're seeing individuals who have HIV, who are on medication regimen that's helping them, and they are able to live normal lives. And we're not seeing the numbers of individuals who are dying. Like when HIV first came on the scene and we saw the quick progression from HIV to AIDS, that's not the case any longer. Let me take that back. We're not seeing that happen as often. We are seeing a transition from HIV to AIDS because individuals are not getting treated. And so because so many individuals are getting treated, there is a decrease in the deaths and the number of individuals who are being diagnosed with AIDS. So 1.3 million people acquired HIV in 2022. Since 2010, the number of people acquiring HIV has reduced by 38%. And originally it was 2.1 million. And so it's definitely decreased from 2.1 million to 1.3 million. So we are seeing a decrease in it. However, there's still work to do. We still need to have these conversations. And so we're having the conversation. So what does HIV stand for? I can't assume that everybody knows what HIV means and what it stands for. HIV stands for human immunodeficiency virus. It's a virus that attacks the immune system, which is, as we talked about, is the body's natural defense. That's our defense mechanism against these viruses and illnesses. And HIV can then lead to AIDS, which is acquired immunodeficiency syndrome, if it's not treated. So what's the best way to know if you have HIV or AIDS? Get tested. How can HIV be transmitted? Through contact with specific body fluids such as blood, semen, vaginal fluids, rectal fluids, breast milk, and from a person who has an active HIV infection. The most common modes of transmission, or the ways that these can be transmitted, that you can become in contact with or contract HIV, is through unprotected sexual intercourse, sharing needles or syringes among drug users, transmission of the infected from the mother to the child, by breastfeeding. And so in healthcare, and many of my other healthcare practitioners and colleagues can attest to this, we have conversations with patients, and I won't go into details of any of the conversations I've had with patients over my years of being in nursing. And why I'm so passionate about educating individuals is because some people don't know, or I don't know, but I don't want to assume that people know what this is and how it's transmitted and how you can treat it and all that stuff. So we're having a conversation. Unprotected sex is still happening. Individuals with multiple sexual partners is still happening. The random hookups are still happening. And I'm not here to judge anyone, but what I will say, protect yourself. You can't rely on someone else to protect you. So you have to protect yourself. So the unprotected sex is one of the main ways that individuals are becoming infected with HIV. And we didn't used to have as much. Well, we did. It just wasn't as popular, like the heroin and the injectable drugs. It wasn't talked about as much. But now we're seeing numbers of individuals who are addicted to drugs that are being injected has exploded. Heroin used to be an old drug that we saw years and years ago. It was popular. Well, that has made its way back on the scene. And so we have more individuals who are injecting drugs into their veins and sharing of needles. And so we have to be diligent and educated about those things. So transmission of HIV, we kind of talked about that, how it attacks the immune system. So once HIV is inside the body, you've, had unprotected sex, or you've shared needles, or somehow you've come in contact with someone who has HIV. And I'll backtrack just a second. Healthcare workers and those who are in the service industry can also be placed at risk for developing or becoming in contact with someone who has HIV. And so that's a real concern for us that are in healthcare. So once HIV is inside the body, what does it do? It targets and destroys the white blood cells, as we talked about before. It's called the CD4 cells, or the T helper cells. We talked about that. These cells are crucial for the immune system's ability to fight off infection and diseases. And so once HIV gets in, as I talked about the Pac-Man kind of goes and it eats up that infection. Well, in Pac-Man, you have that big ghost that comes the big thing that comes to try and get the Pac-Man. And so HIV is that big ghost. I can't remember if it was a ghost or whatever, but it comes and attacks Pac-Man. So Pac-Man is no longer able to eat up the bad viruses that's coming. So once those CD4 cells or the T helper cells have been impacted, then the body can't fight off infection. And so then what happens is the HIV infection begins to take over the immune system, and that virus begins to duplicate and replicate, and it destroys all of those those good cells, and it begins to weaken their immune system. So it then makes that individual, puts them at risk for other infection, which we consider to be opportunistic infections and certain cancers. And so if left untreated, right, then HIV can turn to AIDS. And that's the final stage of HIV. So we want to make sure we're getting tested, that individuals are getting tested. And if someone does have HIV, if they are HIV positive, they test HIV positive, we want to make sure that we have them on a medication regimen that's keeping them there. It's amazing now that we have individuals who were once showing positive as HIV, the virus is no longer detected within their blood work. We don't see it. And as long as they continue to take the medication and take care of themselves, they can remain in that state. And the chances of them converting to HIV or to AIDS is slim to none. Not that it can't happen, but we have treatment. So while there's no cure to HIV, there are antiretroviral therapy, which is ART, which is medication that can treat HIV and prevent it from progressing into AIDS. And so they can live longer, healthier lives. And we're seeing that day in and day out. So the ARTs work by suppressing the replication. It essentially reverses the attack on Pac-Man, as I mentioned earlier. And now Pac-Man is going after this ghost that was trying to attack it. And it's getting rid of it. It's keeping the virus from being able to replicate and take over the immune system. And so that's a good thing. So as long as those individuals are taking their medications, they're doing what they need to do, they're eating well, they're exercising, they're staying, hydrated, they're getting the rest, they're avoiding stressful situations or finding ways to manage and deal with their stress, then it helps, right? So now the immune system is healthier, they're on the medications, they're doing well. So what can we do in terms of preventing HIV? Pretty simple, right? We, one, practice safe habits. So if an individual is someone who is having unprotected sex, make sure you're having protected sex. If you're with a partner, and whether it be a partner, husband, wife, what have you, making sure you're getting tested. And if you're dating, let's talk to those that are dating, and you're starting with a new partner, make sure you guys both go and get tested, not just for HIV, but for all of the other sexually transmitted diseases. So that way you know your status. And if you are individuals who will engage in unprotected sex, you know what your status is. And if you're committed to just you and that partner, then you're okay. However, the issue becomes when there's other partners or other people that are involved in that. You ever heard of the story, the game of telephone, and you have one message and you go to someone else? How I explain it to some of my younger individuals is how when we are engaged in sexual activities with more than one person, you're essentially carrying around all the stuff from this person and that person and this person and that person. And it's now being brought back to you. And we don't know what this person and that person and the next person is engaged in. We think we know what the person that we're with is engaged in. And so hopefully whatever floats your boats and whatever you all want to become involved in, make sure you're taking care of yourself. When I talk to my young girls, Don't rely on the guy to have a condom. You have that condom and you protect yourself, because you're in essence giving that individual control over your life, so to speak. And essentially, it could be your life. Many times we're so concerned about getting pregnant. Pregnancy is the least of my concern when it comes to my, and I'll just say it, my adult children, especially my daughters and my son. He can, our sons can go out and get individuals pregnant. But when I'm speaking to the young girls, pregnancy is the least of my concern. There's things out there that's far worse than getting pregnant and having a baby. We don't want you to become infected with HIV. And one of the ways that you can prevent that is, one, practicing safe sex habits, using condoms. If you're an individual who has an addiction and that's something that you're dealing with and battling with, no condemnation, no judgment here, but avoid sharing needles. There are many different programs that will provide clean needles to individuals. There's many programs that will provide free condoms and use of pre-exposure prophylaxis, which is also considered to be PrEP for HIV, to help with, getting HIV if you're in a risky situation or a high risk situation where you are at a higher risk or coming in contact with HIV. And so regular testing, regular HIV testing is crucial for prevention. Early detection allows us to, one, promptly intervene and initiate medication for, this condition. And the stigmas behind HIV is not like it used to be. We used to see people being treated like they had the plague and nobody wanted to talk with them or be around them. That's not necessarily the case anymore. And we don't talk about it a lot, but it's still here. Just like COVID is still here. And we have to do our due diligence to make sure that we're protecting ourselves, that we're having these conversations with our daughters, our nieces, our cousins, our sons, with everybody, because it's important that we take care of ourselves. And so the month of December is dedicated to HIV and AIDS Awareness Month. And the number of children and babies who have been exposed to parents who are HIV positive and then born with HIV are having to live lives, essentially because of decisions that were made by their parents. They had no control over that. So we can change that. We can further work on decreasing the numbers. 1.3 million individuals worldwide acquire HIV in 2022. We're still in 2023, so we don't have the numbers yet. I'm assuming we'll have those sometime in 2024. But I believe that we can further decrease those numbers. There are still individuals who are dying from AIDS because, for whatever reason, they did not get tested or they did not take the medication. We can prevent that. If my message can prevent one person from contracting HIV, then the goal of this message has done what it's supposed to do. All the years of my schooling and education and my passion for educating my community will have paid off. Take care of yourselves. Do what you need to do. Get your physical exams. Follow up. If something's wrong, we know our bodies will tell us when something is off, when something is not right. Listen to your body. Do what you need to do and make sure you're doing your due diligence to take care of yourself, because we only get one body. And if we're not taking care of it, it's gonna tell on us, and it's gonna let us know that something is off. I don't want to belabor. I don't want to keep, drilling this and badgering you guys about it, but I will, because that's just who I am. I'm that provider, right? Take care of yourselves. Get your physical exams. If you have questions, if there's something wrong, talk with your healthcare provider about it. If you don't have a healthcare provider, if you don't have a primary care physician, if you have not had a physical exam, if you're not feeling well, call us, contact us. We can see you virtually. We can set up an appointment and have you come to our office. We're here. If you just have a question, we can set up a consultation where we can answer the questions for you. But you can reach us at wellslegacyhealth.com. You can also reach us at our phone number by calling or texting us at 321-306-6755. Or you can send us a message via Facebook that you'd like to talk with us. If it's something personal, I would prefer that you reach out to us via our text message or phone because that is HIPAA compliant. You can also visit our website and send us a message through there, which is HIPAA compliant as well. Take care of yourself. Make sure you're drinking your water. Make sure you're eating well. Make sure you're getting exercise. Make sure you're resting. Listen to your bodies. Give your body exactly what it needs. Practice safe sex. Use the condoms. Carry the condoms with you. Make sure they're not expired. I'm having a lecture with a young, I feel like I'm having a lecture with a group of teenagers. But it's important, right? It's important. No matter how old we are, if you're engaging in sexual practices, you need to be protecting yourself. If you are in a committed monogamous relationship, then you should be good. Have those conversations with your partner, your husband, your wife, your spouse, your fiance, what have you. But do what you need to do to take care of yourself. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Thank you all so much for joining me for another episode of Wellness Wednesday with Dr. Wells. I'm hoping that I will have a guest speaker with me at least one of these Wednesdays. Give you some more information and some exciting details. We'll talk to you guys about that later. We have some additional things coming up. Visit our website. We have more services that we're providing to our community. It is our goal that our family, our friends, our patients have what they need to make the best decisions that they can for their health and be able to create a legacy of good health, not just for themselves, but for their family, their friends, and for generations to come. That's my goal. I'm Dr. Latoya Wells. Until next time, stay safe and be well. We'll talk to you later. Have a good evening. Bye.